Hello and welcome everyone. I'm Dan Bevels with Floyd Medical Center, and we're continuing our video series that we have kind of lovingly called Heart to Hearts, because we are talking about symptoms and risk factors and causes and all the issues related to chest pain and heart attacks and things like that. We began this series with an interview with Dr. Jackie Cheatham-Terry, a primary care physician in Cedartown, and also with Robin Cater, who's a clinical educator at Floyd. It's a great conversation about what to look for as far as risk factors and symptoms and things like that that might lead you to think that you are having a heart issue, particularly among women. And today we're going to continue that with a conversation with Tiffany Keinert, who is the system director for Floyd's Emergency Care Center, and also with Dr. Kevin Hardwell, who is the medical director of Floyd's ER. And I thank you both for joining us today.
Thank you.
We're really glad to have you. And today we're talking about those kind of symptoms that we talked about in the first series, and what happens if you come to Floyd's Emergency Care Center exhibiting those symptoms, and kind of what our protocol is and things like that. And I guess, Tiffany, the first thing we want to say is if you are having symptoms that lead you to think you might be having that kind of issue, call 911, right?
Absolutely.
That's the first thing. If you're at home and you think you might be having an issue that's serious, certainly we want you to call 911. Not everyone does. Sometimes they drive themselves or have someone drive them to our emergency care center. So when that happens and someone comes in experiencing some of the symptoms we talked about in the last video, what's our procedure?
Sure, Dan. So when a patient presents to the emergency department, and that could be through our EMS arrival or through our front door, we do try to, we look for those very signs and symptoms of a heart attack, as you said. So the very typical signs would be, crushing chest pain, mid-sternal pressure, radiating down either arm into your jaw, diaphoretic, and those would be very, very classic symptoms of a chest pain, and we would implement our chest pain protocol. That protocol, those patients would actually fall into our high-risk protocol, and we would go ahead and implement a series of lab work, radiology, and of course the single most important test that we do immediately is our EKG. We perform the EKG, and then we take it to the physician for their interpretation to help determine if the patient is having a cardiac event.
How does that compare to just your average everyday person that comes into our ECC? What's the difference there?
Well, one of the main differences for those particular patients is we do have the nurse-led protocol. So based on the very specific clinical presentation of the patient, then the nurse is going to go ahead and immediately implement that protocol that's specific for those chest pain patients.
Okay. Dr. Hardwell, when we talk about nurse-led, how is that different than what might occur in other situations?
Well, we don't have physicians sitting right at the front door, and so anybody that comes in, the first person they see is the nurse, and we have experienced people, and they get the basic story, and if it falls into the category that we're talking about here, then it triggers a series of events, and the first event is the EKG that we're talking about, and that's brought straight to the physician to look at, and a lot of times we jump straight to the end, which is call the cardiologist and the cath team and get ready to proceed with a heart cath. But if it's normal, then we are not suggestive of an acute heart attack, then it's a little bit different path.
One of the things I remember Robin saying in the earlier videos that time is muscle. So, and I'm assuming that's why we want to address that issue just as quickly as possible.
Yes.
Yes, we have very specific goals about getting people to the cath lab just as fast as possible, because time is muscle. And we do try to get them over there as fast as they can to get those arteries open back up, and help preserve their their heart.
So, Dr. Hardwell, what are some of the very real risks of delaying that response?
Well, if someone is having a heart attack, then their heart's very unstable, and they're at risk of jumping into a rhythm that fall over in the wrong rhythm, and sudden death is the most imminent risk. But then also, the more time you wait, the more damage there is to the heart muscle, and it can lead to things like heart failure and significant complications from the heart attack.
And I guess one of the tricky things is that men and women do present differently. So Tiffany, when you talked about the crushing chest pain,
Yes.
that might not be the same thing that's being experienced by a woman. Can you talk a little bit about that?
Absolutely. So our protocol divides the groups up into a very typical chest pain presentation, but we also have those patients who are women or over 75 or may have diabetes that don't necessarily come in with your typical chest pain symptoms. So they may have more of your abdominal or epigastric pain, fatigue, or just the nausea, vomiting. And so we actually include those in our protocol as well. And so they go back for the immediate EKG just the same as a patient who presents with the more classical symptoms of chest pain.
Okay. And again, our nursing staff is trained to at least lead that and make that determination to some degree.
Absolutely. Yes.
So I guess in our wrap up, just a synopsis, take us through again. So I have a patient that comes through the door that's exhibiting those symptoms. Kind of walk us through it again.
Sure. So we have a nurse at our front desk, and so if a patient presents to the emergency department with either typical chest pain symptoms or atypical chest pain symptoms, we're going to implement that immediate nurse-led protocol. Again, with the most important aspect or test of that is the EKG. We're going to perform that EKG. We're going to take it to the physician, and they're going to determine the course of action, whether we call immediately to the cardiologist and activate that STEMI team, or whether we do further testing.
And I guess, Dr. Hardwell, one of the questions we often get in the community are about those cardiologists, and at Floyd we have the same access to them as anyone else would in the region, correct?
Yes, cardiologists work and you see the same ones no matter what facility you show up at.
So we can assure people that they're going to get quality care when they come into Floyd's ECC.
Absolutely, that's our goal.
All right. Well, very good. Well, we appreciate you joining us today and talking through this. And again, I think one of the things we want to stress is don't wait. You know, if you are exhibiting those symptoms, call 911 and be brought in by ambulance. But if you're not, just trust that we're going to take care of you.
Yes, we are.
Yes.
All right. Well, thank you both for joining us today.
Thank you.
Thank you.
And thank you for joining us. We want to encourage you to continue watching these series. You can find them on Floyd social media, on Facebook, and also at heart.floyd.org. And as a matter of fact, there's a wide range of information available there. Again, some of the risk factors and symptoms and signs and things like that of heart issues. You can also find some great information about how kindness can help your heart and about how controlling anxiety and stress can contribute to heart health as well. In our next video, we're going to talk about that one. So keep checking back for great information at heart.floyd.org. Until next time, I'm Dan Bevels with Floyd Medical Center. Thanks for joining us.